So if you are someone who's been struggling to conceive and is diagnosed with unexplained infertility, I understand how difficult and frustrating that feels. It's almost like hitting a roadblock without knowing the cause of why you are unable to conceive when everything seems absolutely normal. And also the emotional setback that comes month after month can be very draining. So if you as a person or as a couple are sailing in this boat, I am sure this video is going to be very helpful to you. So in this video, we're going to discuss about when do we actually diagnose a couple as someone who's struggling with unexplained infertility, and what is it that you can do on your front to aid your chances of conception. So if this is something that interests you, definitely watch the video till the end. Hi everyone, if you're new here, I am Dr. Zainab Tajir. I'm a homeopathy consultant and psychological counselor. I specialize in helping women balance their hormones and help couples conceive naturally through homeopathy and holistic lifestyle changes. So if this kind of content seems like something you are looking for, definitely consider subscribing to my channel. Now, when do we actually diagnose a couple as someone who's struggling from unexplained infertility? So there are a few criterias. In case of women, let's say the woman has absolutely normal hormonal test reports. So she has normal FSH, LH, testosterone, estrogen, progesterone, prolactin, etc. She has extremely regular periods and also ovulates well every single month. She does not have any uterine abnormalities or any structural problems that are present in the reproductive tract. Also, you've run an HSG test for her and both her fallopian tubes are patent. Her ovarian reserve as well is good, so she has a good serum AMH. When all of these tests come back normal, we say that the woman does not have any conceivable problem that could be preventing a conception. Similarly, for a man, if he has a very good semen analysis, so a good sperm count, good motility, good morphology, and he does not even have any problem with erection or premature ejaculation, in that case we say that a man also has a very good fertility. So if we cannot diagnose any conceivable medical problem in the couple and also all the fertility tests come back normal, we diagnose a couple as someone who falls under the category of unexplained infertility. And almost 30% of couples that struggle with difficulty in conception are actually diagnosed with unexplained infertility. So let us delve into more details of what you can yourself do to improve your chances at conception. The first is taking care of a woman's fertile period. So we are aware that a woman is only fertile for 3 to 5 days before she ovulates and on the day of ovulation. And so it's very important for you as a couple to track the woman's fertile period, track her ovulation, and then plan your intercourse accordingly, because timing is the most crucial when it comes to conception. There are so many practices that you can use when it comes to tracking your ovulation, right from measuring your cervical discharge to your basal body temperature to secondary signs of ovulation that your body gives you. You can also use devices like ovulation predictor kits, or you can do follicular studies to understand when a woman is ovulating. But making the most of her fertile days is the most important thing when it comes to conception. I also have an entire video about the best days that you can fall pregnant that goes into much more details about ovulation. If you are not personally aware about it, I'm sure the video would be very helpful. You can check the video up here. The second important thing is diet. Your diet can play a very crucial role when it comes to improving your fertility, and so it's so important for you to be mindful about it. It's very important for you to include the right nutrients that nourish your body so that you can maintain your health and in turn also improve your reproductive health. So it's very important for you to stay away from refined carbs, refined sugars, processed foods, maida, junk foods, etc. because these foods are known to create inflammation and insulin resistance, which can in turn disrupt your hormone. And the delicate balance of hormones plays a very important role when it comes to conception. Then it's equally important for you to stay away from simple carbs and opt for more complex carbs so that you can maintain your blood sugar as well. Include good amount of proteins in your diet, and also don't forget healthy fats that come from ghee, oil, olive oil, nuts, seeds, etc. So it's very important for you to follow a balanced plate method where you fill half your plate with fruits and vegetables, 1/4 with proteins and 1/4 with complex carbs, along with some good fats, so that you can get the right nourishment that your body needs when you are along the trying to conceive journey. The next important thing is exercise. Now, according to a statistical survey that was carried out by the American Institute of Gynecology, they found that couples who indulged in some form of moderate exercises, at least for 30 to 40 minutes a day, minimum 4 to 5 times a week, had better chances at conception as compared to those who did not exercise at all. So there is a direct correlation between exercising and a good hormonal balance and fertility. Secondly, exercising, yoga practices are known to improve blood flow to your reproductive organs, which in turn helps to improve the chances at conception. So it is very important for you to indulge in some form of exercise, be it yoga, pilates, walking, gymming, whatever you personally enjoy if you are trying to conceive. The fourth important thing remains supplementation. So we do know that our body's nutritional requirements increase when you are planning for a conception. So it's important to introduce basic supplements which can help you keep up with this nutritional requirement. So supplements like zinc, folic acid, vitamin D, vitamin B6, vitamin B12, selenium, etc. can all play a very important role, especially if you are planning for a conception. Now, every person's nutritional requirements are different, so there is no one size fits all that works here. If you are someone who is planning for a conception or is struggling with unexplained infertility, it's very important for you to speak to your healthcare professional and understand which supplements would work for you. And the last and the most important thing is homeopathy. Now, I'm a homeopathy practitioner myself who's been practicing homeopathy for many years now and have had hundreds of successful cases of unexplained infertility that have been able to conceive through homeopathy. And so the gentle stimulation of homeopathy can sometimes play a very important role in bringing about the harmony in your body that can somehow aid conception. So if you are someone who's tried everything and are still struggling to conceive, introducing homeopathy can be very helpful to you, so you should definitely consider that. Now, if you have any more questions related to this, please feel free to leave them in the comment section below. And also, thank you so much for sticking by till the end. I will see you again next week.